The top stories tonight in Y News. The Department of Health assures that the UK variant of the coronavirus disease has not yet been detected in the country, with the government forming a task force to monitor the new COVID-19 variant.
3 detained suspects in the death of flight attendant Christine Dacera were released following an order from the court, while the Philippine National Police still hunts for other persons of interest.
The Philippine Health Insurance Corporation to lose around 13 billion pesos this year with deferment in its members' contributions.
And the World Health Organization issues a rare criticism of China for blocking access to researchers to study the origins of COVID-19. Good evening, Philippines and the world. Today is Wednesday, January 6, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I am Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide with the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news, the Department of Health assures that the Philippines still remains free from the new variant of COVID-19 virus detected in the United Kingdom. This is amid reports that one of the passengers of a flight from Manila to Hong Kong tested positive for the said variant. Aiko Miguel explains why.
It appeared in the sequencing conducted by the Philippine Genome Center on the 305 samples who tested positive of COVID-19 last November and December that they don't possess a COVID-19 UK variant called the B117. This is why Health Undersecretary Maria Rosario Vergere allays public fears that the new variant has entered the country.
Sa ngayon, currently, the UK variant has not been detected in any of these samples that were sequenced by the Philippine Genome Center. But we are still reminding everybody that we still need to strictly comply to the minimum public health standards.
Hong Kong health officials earlier said it has detected the presence of the new and more infectious variant in a passenger who returned from the Philippines last December 22. The case involves a 30-year-old female Hong Kong resident who flew from Manila via flight PAL PR300. The DOH had coordinated with the Hong Kong International Health Regulation Focal Point to get more details on the passenger, but the DOH has not received any response yet. Undersecretary Vergere said they have also conducted contact tracing of the passenger's close contacts.
The line list of passengers, we have 40. We were able to zero in on 2 individuals with a profile of 30 years old female. So may dalawa tayo and we were able to get the contact address, the contact numbers and all. Unfortunately, both contact numbers cannot be, hindi na po sila sumasagot, patay ang telepono. So ito pong contact address ay tinatawagan na ho natin ang mga pamilya. Also, aside from these 2 individuals, we also are doing contact tracing na rin dito sa additional 38.
Based on the information received by the DOH, the passenger tested negative of COVID-19 before the passenger left the country. According to Dr. Edsel Salvana, who is a member of the technical advisory group, that we cannot conclude yet that the passenger got the virus from the Philippines. Dr. Salvana adds, more information is needed from Hong Kong health officials.
As to whether nakuha niya sa Hong Kong, it really depends on the timing. Kasi ganito lang yan eh. Kung may negative siyang test noong December 22, it takes usually 3 to 5 days before it become positive again. So if nakuha niya yan sa Hong Kong and nag-test siya sa Hong Kong after December 27, then it's more likely na doon niya nakuha yun because we know that there are already cases of the UK variant in Hong Kong.
The Department of Health assures there will be strict border control in the country. The DOH says there are 6 additional countries in the travel ban list but has not yet given details on it. According to Dr. John Wong, an epidemiologist, strict border control should really be implemented to prevent the entry of the UK variant. Once the B117 variant becomes dominant in the Philippines, COVID-19 cases will increase to 15 times more, or equivalent to 300,000 COVID-19 cases in a month's time.
This can become very serious or very dangerous if the variant becomes the dominant strain. No? But we should also remember na it's within our power to control this.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Philippine government is confident that the country is prepared to respond against the new coronavirus variant that is believed to be more contagious. Health Undersecretary Maria Rosario Vergere has also been named as head of a group of experts tasked to study the new COVID-19 variants. Rosalie Cos will tell us why live. Yes, Rose, good evening.
Good evening, William. The National Task Force Against Coronavirus Disease is confident about the preparations being done by the government to prevent the entry and spread of the UK coronavirus variant. The Interagency Task Force Against Coronavirus Disease is also in constant communication and consultation with experts to intensify further the government's response. The NTF believes the Philippines can respond effectively in case the new strain of the virus through strict conduct of detection, isolation, tracing, and implementation of minimum health standards.
Tayo po ay prepared at ibigay na po natin kay SILG na bigyan ng babala rin ang kanilang ating mga mayors at saka mga governors na tingnan at i-monitor yung tinatawag nating syndromic surveillance at saka case finding.
In relation to this, the official said the Philippines was able to control a surge of local transmissions and infections in the country last July to August. Meanwhile, in compliance with the pronouncement of President Rodrigo Duterte to create a task force of medical experts who will focus on studying the new coronavirus variant, the IATF has approved the establishment of a technical working group on COVID-19 variants through Resolution Number 92. The TWG aims to monitor and identify the occurrence of SARS-CoV-2 variants in the country and provide policy recommendations to the IATF on the response against any variants. This will be composed of representatives from various government agencies and will be led by Health Undersecretary Maria Rosario Vergere as chair and Philippine Council for Health Research and Development Executive Director Jaime Montoya as co-chair. William, also presidential spokesperson Harry Roque, said that any individual arriving in the Philippines who may have already been inoculated with COVID-19 vaccine in other countries or territories are still required to undergo mandatory testing and quarantine protocols. This is still part of the intensified COVID-19 response of the government. Back to you, William.
Thank you, Rosalie Cos, reporting live.
The Philippines coronavirus disease 2019 tally hit 480,737 today after the Department of Health announced 1,047 new infections as 3 laboratories failed to submit reports on time. Davao City registered the highest number of new cases at 79, followed by Quezon City with 58, Laguna with 55, Bulacan with 40, and Cagayan de Oro with another 40. Total recoveries also rose to 448,700 after 339 more patients recovered from the respiratory disease as the death toll reached 9,347 with 26 new fatalities. There are also 22,690 active cases undergoing treatment or quarantine.
Meanwhile, some 6,000 police officers will still be deployed at the Quiapo Church despite the cancellation of the massive Traslacion procession on Saturday. Dante Amento tells us why.
Authorities expect devotees to still come in droves on Saturday, January 9, 2021, to hold the Traslacion in Quiapo. As part of its preparation for the occasion, the PNP will set up various checkpoints to inspect bags, check temperatures, and to ensure the devotees are wearing face masks and face shields. Manila Police District Director Police Brigadier General Leo Francisco said some 6,000 policemen will be deployed to control the entry of people.
Meron kaming counter at pag sinabi sa amin ng otoridad ng simbahan o ng mga ihos na katulong namin na puno na ang mga nasabi kong mga lugar na yon, i-stop namin ang pagpapasok.
No vendors will also be allowed near the Quiapo Church and its premises starting tomorrow.
Una, pinagbawalan muna natin ang mga vendors para maging malinis to. Handaan natin na ang pupunta ay na-check ng kanilang body temperature, meron silang face mask, may face shield, at sa pila, kailangang i-maintain yung physical distancing.
Several roads in Manila will be closed to traffic starting Friday night, January 8. In a traffic advisory, the Manila Police District Traffic Enforcement Unit announced the following road closures, parking plans, and road reroutings. The southbound lane of Quezon Boulevard, Quiapo, from A. Mendoza to Fogoso Street until Carlos Palanca Street. Northbound lane of Quezon Boulevard from Carlos Palanca Street to Fogoso Street. The westbound lane of España Boulevard will also be closed from P. Campa to A. Mendoza Street, and also the stretch of Evangelista Street from P. Paterno Street to Recto Avenue, and the stretch of Palanca Street from Carriedo to Plaza Lacson and P. Casal Street. Meanwhile, starting Saturday midnight, the stretch of Ronquillo Street from Rizal Avenue to Plaza Santa Cruz and the stretch of Bustos Street from Plaza Santa Cruz to Rizal Avenue will also be closed. Authorities appeal for the public's cooperation and, if possible, to just stay at home and monitor the activities through social media.
Sundin natin ang patakaran na ibinababa ng IATF. Kung tayo ay edad na mababa sa 18 at mataas sa 65 years old, wag na tayong pumunta. Kung tayo ay walang face mask, face shield, wag na rin tayong pumunta. At kung tayo naman ay outside NCR area, kailangan may mga dokumento kayong maipapakita kung bakit kayo pupunta.
The Manila City Government decided not to push through with the annual event because it violates the IATF guidelines and could be a super spreader event of COVID-19. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Metro Manila Development Authority Chairman Danilo Danny Lim has passed away over a week after announcing that he tested positive for COVID-19. He was 65 years old. Lim posted in his Facebook on December 29, 2020, that he was experiencing mild symptoms and submitted himself in isolation. According to reports, Chairman Lim died due to cardiac arrest at around 8 a.m. earlier today. Malacanang extended its deep condolences to the family and loved ones of Chairman Lim, saying that the late chairman served the MMDA with professionalism, competence, and integrity under the Duterte administration. Apart from Malacanang, several other government officials have expressed their sympathies and loss of a good leader and public servant. The MMDA said Lim's remains have been cremated and will be buried in the libingan ng mga bayani on Saturday.
For those watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notification. You may also follow us on Facebook.
The Philippine National Police warned that they will file a case to cite for contempt the suspects in the death of Christine Dacera if they fail to surrender to authorities. Leah Ilagan will tell us why.
PNP Chief Police General De Bolsinas confirmed that they already issued a subpoena for the other suspects in the death of flight attendant Christine Angelica Dacera. Sina said the CIDG will not only assist the Makati Police in investigating the incident, but will also file a case to cite for contempt the suspects if they fail to surrender within 72 hours.
That's why we're appealing to the family to have them surrender para po mapabilis po ang justice.
The chief of the Philippine National Police also stands by the rape-slay angle in the death of Christine.
We have discussed this with the investigators and the other senior officers. I think there's really rape. Okay? Look, di ba? Yung babae, di ba? Okay? May bruises, may ganito, may confirmed lacerations, tapos may fluid sa private parts niya, di ba? But I believe this investigator that really happened.
But in the result of the autopsy report obtained by UNTV, there were no semen found in the victim's private part. The hymen, however, had presence of deep but healed laceration. The report also says that there is no presence of illegal drugs and other substance in the victim's body, but instead they found a blockish fluid in her stomach. A contusion and abrasion was present in her knee and thigh, while a contusion in her right hand has a superimposed needle puncture mark. Based on the autopsy report, Christine's cause of death is ruptured aortic aneurysm. Meanwhile, the family of Christine sought another autopsy and are now waiting for the results to dispute that she died of natural causes. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The Makati City Prosecutor's Office has ordered the release of the 3 suspects tagged in Christine Dacera's case. In its 3-page resolution, the prosecution said there is a need to conduct a regular preliminary investigation to determine whether Dacera was raped and or killed and whether the death was due to rape or other reasons. It noted that at this point, the pieces of evidence submitted are insufficient to establish that Dacera was sexually assaulted or raped. The investigating prosecutor also directed the police officers to submit additional evidence such as the DNA analysis report, toxicology or chemical analysis, and the histopath examination report. Before this, some of the suspects broke their silence and denied the allegations. In a Facebook post, Ray Anglis, one of the suspects who was with Dacera during the party, said the truth will set them free. He also asked for prayers for Christine and the Dacera family. Anglis added they will always love Christine and that they will try to survive the harassment and all the fake news. Valentine Rosales, who's also Christine's friend, took to his Instagram stories and said that the alleged rape slay is absurd, fake, and disgusting. He also demanded for the release of the autopsy report, noting that no one touched Christine. Meanwhile, in a series of media interviews, another suspect being tagged in the case, Gregorio de Guzman, son of singer Claire de la Fuente, also denied the allegations. According to de Guzman, they were the ones who helped Christine when they saw her unconscious body in a bathtub. He added that they even reported the incident to the police and they did not leave Christine up to the hospital. For de Guzman, the rape allegation is absurd, noting that he is gay and he never had sex with a woman. The hearing for the preliminary investigation, including the other suspects who remain at large, is set on January 13 at 10 in the morning.
The Philippine Health Insurance Corporation, or PhilHealth, will lose around 13 billion pesos this year with the deferment of the increase in its members' contributions. Ray Pelayo explains why.
The Philippine Health Insurance Corporation, or PhilHealth, is optimistic that President Duterte's commitment, as well as by Congress, will generate the necessary funds that will be needed by the agency to continue its programs. PhilHealth's projected collection this year is estimated to reduce by 13 billion pesos after the suspension of its premium hike. But PhilHealth spokesperson Ray Balenya said that no programs will be sacrificed and they will continue to try their best to give the right service to their members. PhilHealth allocation from the 2021's General Appropriations Act amounts to 71 billion pesos. Aside from the government's help, the agency is also expecting high rate of direct contribution from its members this year despite the effect of pandemic.
Merong 13 billion na hindi natin ma-realize kung ito po'y ma-defer sa taong ito. Ngayon, umaasa naman tayo sapagkat ang commitment ng Pangulo sa tulong na rin ng mga iba-ibang ahensya na humanap ng pondo na kakailanganin po ng PhilHealth na dapat sana'y ma-generate ng nasabing premium adjustment.
Baleño clarified that the funds for COVID-19 response are ready, including the payables for COVID-19 tests. This week, PhilHealth will pay another 265 million pesos to the Philippine Red Cross out of its 728.6 million balance. Baleño notes that they pay based on the complied documents in accordance with the Commission on Audit.
Hindi issue dito yung pondo o pambayad. Ito ay ginagarantiyahan natin na meron tayong pondo. In fact, nakalaan na yan yung ating pondo para sa COVID response natin.
PhilHealth also offers packages for isolation of individuals affected by COVID-19 worth 23,000 pesos. If things get worse, packages for treatment ranges from 43 to 786,000 pesos. Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
President Rodrigo Duterte has signed laws extending the validity of the 2020 national budget and the Bayanihan to Recover as One Act, or Bayanihan 2. Republic Act 11520 extends the validity of the 2020 General Appropriations Act until December 31, 2021. Under this measure, all appropriations authorized in the 2020 budget, including budgetary support to government-owned and controlled corporations or GOCCs, will be available for release and disbursement until the end of the year. Meanwhile, Republic Act 11519 extends the validity of the appropriations under the Bayanihan Law 2 until June 30, 2021. The law expired on December 19 last year. Duterte signed the two measures on December 29, 2020.
For those watching us on YouTube, please click the subscribe button you see on the right side of your screen and ring the bell for notification. You may also follow us on Facebook.
The Food and Drug Administration is set to release its decision on whether to allow the emergency use of Pfizer's COVID-19 vaccines in the Philippines. Meanwhile, the country's supply of the most in-demand vaccine will likely arrive by the third or fourth quarter of this year. Aiko Miguel reports.
Based on the timeline presented by the Food and Drug Administration, it is possible that by next week, the Food and Drug Administration will release their decision on Pfizer-BioNTech's emergency use authorization in the country.
Ang Pfizer po, ang maganda dito, medyo madali po siyang evaluate dahil meron na siyang EUA galing sa United Kingdom, sa US, sa Canada, sa Switzerland, Singapore, at iba pang bansa na alam po natin na very strict yung kanilang regulation. Meron na rin po siyang WHO emergency listing na nire-recognize po ng ating bansa according to EO 121.
Once Pfizer gets the EUA, the country will likely receive its supply of vaccines by the third or fourth quarter of 2021. Vaccine Czar Secretary Carlito Galvez Jr. said this is because there is great supply demand on Pfizer-BioNTech supply.
Nakikita po natin na ang Pfizer ang most in-demand na brand. And nakikita po natin na most likely magiging available po to ng Q3 and Q4. Kasi po nakikita po natin with the challenges that they had, talaga pong hindi po makakayanan na magkaroon po ng tinatawag natin na earlier deployment on the first quarter and the third quarter. Nakita natin na yung mga countries na nakita natin na nagkakaroon ng spike at second wave ngayon, yun ang nakita natin sinusuplayan natin ng Pfizer.
The government plans to vaccinate 50 to 70 million Filipinos this year. 148 million doses of vaccine are expected to be received in the country from 7 vaccine manufacturers. Meanwhile, clinical trial application of China's Sinovac and Clover Biopharmaceuticals are currently being reviewed by the FDA, but Janssen of Johnson & Johnson will start their clinical trial this month.
Mag-uumpisa na po sila ngayong buwan na ito. Probably by next week, ito po yung clinical trial nung kanilang dinedevelop. Very promising vaccine.
Authorities stand firm that the country is not falling behind in securing supply of COVID-19 vaccines.
The rollout and the deployment of the vaccines is not just about the distribution. It's also about ensuring that we are monitoring the safety of these vaccines when we are giving it to the populations. As I have said, we see that the country is on track of setting up the systems.
potential COVID-19 vaccine of the University of Oxford AstraZeneca of Australia has a good evaluation and is the cheapest according to Secretary Galvez. Today, FDA confirms AstraZeneca has submitted their EUA application. On the other hand, 15,000 Filipinos in Metro Manila will voluntarily participate in WHO Solidarity Trial of vaccines this month. Philippines and Colombia are the first two countries to participate in the Solidarity Trial of vaccines that'll start this month. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine government expands its travel restrictions to 6 more countries, including Portugal, India, Finland, Norway, Jordan, and Brazil. This means foreign passengers coming from these nations or who have been to these countries will be prohibited from entering the Philippines starting January 8 until January 15, 2021. However, Filipino citizens who have been to these jurisdictions are allowed to enter the country but are required to undergo an absolute facility-based 14-day quarantine period.
In other news, the Commission on Elections, or COMELEC, sees the demand for voter registration for the 2022 national elections, but new voters were held from registering. Asher Kadapan Jr. will tell us why.
The Commission on Elections revealed that the voter registration turnout in the year 2020 was far from their target. COMELEC said that they were able to register only less than 1 million registrants last year out of about 5 million individuals expected to register within the current registration period. Most of these are new registrants who just became eligible to register as a voter after turning 18 years old. Although COMELEC believes that the new registrants are very interested to register, the community quarantine restrictions held them from participating in the voter registration.
Yan ang pinakamalaking demographic na nagpaparehistro at sila pa mismo yung pinagbabawalan ng IATF na lumabas ng bahay. So, nung nagsimula itong registration period natin, sila yung unang gustong-gusto magparehistro pero hindi makalabas kasi bawal.
COMELEC added that the threat of COVID-19 also hindered new registrants to go to the registration offices. While the COMELEC offices have very limited capacity with only 50 registrants per day due to the reduced workforce and implementation of health protocols. With still about 4 million registrants to register until September 30, the Commission anticipates a lot of pressure in the coming months. As a measure against the expected influx of registrants, COMELEC is looking to put up satellite registration in malls.
Ang problema natin, dadagsa ang mga tao pero hindi naman malaki yung mga registration centers natin. Because right now, we do it only sa COMELEC offices and those COMELEC offices are small, no? So, kailangan magkaroon tayo ng capability to conduct satellite registration. And hopefully, by the end of January, conditions will be such na pwede na tayo mag-satellite reg.
COMELEC appeals to the public to register as early as possible to avoid the expected influx of registrants amid the pandemic. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
And for the news abroad, here's Kath Dumaraos reporting live from Bangkok, Thailand.
Good evening, William. The World Health Organization has issued rare criticism of China for blocking access to researchers. A team of 10 experts hopes to find the origin of the virus and how it jumped to humans. Marvi Dauphin will tell us why live.
Kath, experts drawn from around the world were expected to visit Wuhan, where COVID-19 first emerged. But according to WHO's Director General Dr. Tedros Ghebreyesus, the team received last-minute notice from Chinese officials that they were not yet approved to enter. Dr. Tedros emphasized that he made it clear that the mission was a priority for the United Nations Health Agency and that China gave assurance that it is speeding up the internal procedures for the earliest possible deployment. Dr. Ryan hopes for China's prompt response to Dr. Tedros's immediate call for action. Beijing, though, consistently dismissed criticism of its handling of early cases and defended that more and more studies are showing that the virus emerged in multiple regions. WHO highly speculates this narrative. Meanwhile, as many countries begin to roll out vaccines but still struggle to protect people against COVID-19, the WHO still recommends that 2 doses of the Pfizer-BioNTech vaccine be administered within 21 to 28 days. But the panel also notes that countries should have leeway to spread out the shots over 6 weeks so that more people at higher risk of illness can access them. Given the limited supply of vaccines as production ramps up, Dr. Alejandro Cravioto said that international travelers are not to be prioritized for the Pfizer jab unless they were in a very high-risk group, such as the elderly and those with pre-existing medical conditions. Despite the delays in the investigation of the pandemic's birthplace and in rolling out inoculations, the WHO continues to encourage governments to impose lockdown measures to halt the virus spread while facing massive demand for vaccines, which it sees as the best way out of the global health crisis. Kath?
All right, Marvi, thank you for that live report. Ambulance workers in Los Angeles County in USA have reportedly been told not to transport patients with little chance of survival to local hospitals. Miguel Rey de Leon will tell us why.
Due to shortage of beds and medical staff brought about by COVID-19 surge, health officials in Los Angeles directed first responders to stop bringing adult patients who cannot be resuscitated to hospitals for treatment. Emergency workers are also being told to ration oxygen, which is in short supply. This is part of the measures taken nationwide by various states and officials of local governments because of record increase in COVID-19 cases, hospitalizations, and deaths. In a statement, Los Angeles County Emergency Medical Services said patients in traumatic full arrest who meet current reference 814 criteria for determination of death shall not be resuscitated and shall be determined dead on scene and not transported. Reference 814 refers to the policy of the county on determining and pronouncing death in a patient who has not been transported to a hospital. California has reported almost 73,000 COVID-19 cases on Monday, the highest since the start of the pandemic. Total COVID-19 cases reached 840,611 and 11,071 deaths have been reported by the Los Angeles County. Throughout California, cases have exceeded 2.4 million according to an update by the Centers for Disease Control and Prevention. The most populous state in the US has been hit hard by the recent coronavirus surge. Health authorities have attributed this to holiday gatherings in November. Los Angeles is one of 2 counties in California which reported shortage of intensive care unit beds. Miguel Rey de Leon, UNTV News and Rescue, USA. We serve the people, we give glory to God.
A compassionate U.S. doctor wiped away the death of nearly 200 of his patients who are battling cancer. Ia de Vera details us why live.
Cath medical bills of 200 cancer patients amounting to nearly $650,000 or 31.2 million pesos has been forgiven by U.S. oncologist Dr. Omar Atiq. Dr. Atiq, who is originally from Pakistan, founded the Arkansas Cancer Clinic in Pine Bluff in 1991, providing treatments such as chemotherapy, radiotherapy, and CAT scans. He is an oncologist who provides medical care and treatment for persons diagnosed with cancer. After nearly 30 years in business, Dr. Atiq closed his treatment center in Arkansas last year due to staff shortages. He is currently a professor at University of Arkansas for Medical Services in Little Rock. He worked with a debt collection firm to collect outstanding payments. However, realizing that many people are unable to pay and families may be affected by the pandemic, Dr. Atiq and his wife made a decision to forgive all the outstanding debts. This past December holiday, Dr. Attic wrote to patients informing that they decided to forego all balances owed to the clinic. Dr. Attic is described by people around him as a very caring individual, an easy to work with as a client, a very smart and compassionate doctor. Kath?
Thank you, Iya, for that live report. And those are the reasons behind the news in other parts of the globe. Back to you, William.
Thank you, Kath Dumaraos, reporting live from Thailand.
And those are the reasons behind the news, January 6, 2021. I am Harvin Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.